Hi everyone, welcome to Core from the Base. This is class 5 and we're going into our lower core. We will be trying to dissociate movement between our hip flexors and our lower core because a lot of people will overactivate their hip flexors instead of using lower core to help with them. And in this class we will need a pillow, a chair, a band and a mat. So go and get your things and I'll see you now. Okay, we're going to start with our pre-assessment. So get your chair at the end of the mat, and then I want you to bring the bum a little bit closer to the chair, lie down onto your back. The closer the bum is to the chair means how much more of a beginner you are. So in this position, I want you to lower your back down onto the ground, belly button pulling into the spine. Take one leg up into a dead bug position and then take the other leg up. If you can straighten both legs, that's great, because this will be what we need to do. Our pre-assessment is starting from here, and then we have to lower our legs all the way down to the chair and lift it back up. And I want you to have your hand underneath your back to see if your back lifts off the floor or if it doesn't. So do that 2 times. If it's too easy, if your back is not moving, you're quite stable, then move the bum back a little bit further. And then measure it out, make sure you know where it is. So for me now, it is by my ankle where the chair is. And then we take our legs up, keeping the lower back down, controlling through the core, lower core, drop the heels down and lift back up. Do it twice to see if you've got good control and lift. And then you can move your chair away and bring your pillow, even if it's 2 pillows, because it's quite difficult to get to this level. So you can have 2 levels here and then lie down, legs up into the sky, and then you're going to control the heels all the way down to touch and lift back up. And if that is easy for you, you can move your pillow away and then go into a full leg lower, taking the heels to touch and lifting all the way up without getting your lower back to tilt off of the floor. So that's our pre-assessment, so we will do that again at the end. And now we'll start with the class. So lie down on your back. We're going to activate into our deep inner core. So just start with your breathing, pushing your diaphragm up into your hand, or your stomach up into your hand as you inhale. Not too much outwards. It's always difficult for the first few, so just do 3 deep breaths. Exhale, pull the ribcage back together. Inhale. Push into your hand and exhale. Last one, inhale. And as you exhale, activate into the pelvic floor by squeezing the 2 sit bones together without the glutes activating. Keep it active here. Pull up towards your belly button and then pull the belly button down into the ground. Ribs down towards the hips. Keep breathing. Inhale into the hand. And exhale, place hands onto the inside of your pelvis and feel the activation of your TA here. Make sure you feel the muscle push up into your fingers there. Then keep your pelvic floor active. Keep the ribs engaged. Place your hands onto your thighs. Inhale, lifting up into your hand. Exhale, place the hand onto the thighs and push the thighs into your hands. Keep this activation and hold it here for 30 seconds. Keep the pelvic floor active without squeezing the glutes. Keep tilt or tucking the tailbone in without squeezing the glutes and using your thighs to push into your hands. Hold it here. Keep breathing, even if you can just do small breaths, it's okay. But every time you exhale, pull the ribs down towards the hips. 5 seconds. And rest. Now we're going to come into a dead bug position and hold that same contraction. So just start breathing, inhale, pushing up into your hand, exhale, right leg raises into dead bug. Inhale, and exhale, left leg into dead bug. Inhale, exhale, get your sit bones to pull together, pelvic floor becomes active. Inhale, exhale, TA becomes active. Make sure you can feel it on either side of the pelvis. Keep the pelvic floor active in this position, keep your TA active, and then pull belly button to spine. Place the hands onto the thighs and push the thighs up into the hands and the hands into the thighs. Hold this resistance for 30 seconds, concentrating on your pelvic floor, on your TA, on your breathing. Make sure you're breathing in and up and out and in. In and up and out, and pulling the ribs in. Keep going. Keep your lower back on the ground, pelvic floor active. It might lose it, so just keep going back to squeezing the sit bones together, holding your urine in a sense of the word. Keep it there. 5 seconds. And take the knees into the chest and hug them in. One last way to activate, we're going to have our legs straight. So if you don't have the hamstring length, it's okay, but I want you to try and have at least one leg straight. So we'll do it twice. So starting from the bottom, tucking in the tailbone, belly button to spine. Inhale into your hand, exhale. Activate the pelvic floor. Inhale, exhale, make sure TA is active. Inhale, exhale, right leg raises up without the lower back coming off the ground. Inhale, and exhale, left leg comes up into tabletop. Inhale, exhale, make sure pelvic floor is still active. Inhale, and exhale, right leg raises. Inhale, and exhale, if you can, raise the left leg. Inhale, and exhale, keep pelvic floor active, hands onto the thighs. The hands are pushing into the thighs and the thighs are pushing up into the hands. Keep active here. If you can't do it, you're just raising one leg and the other leg is lowered. Keep going. 30 seconds. Pelvic floor is active. Belly button pulling to spine. Breathing in the process. Activate the pelvic floor. Don't let it go. 5 seconds. Keep pushing the hands into the thighs, thighs back up into the hands, and hug the knees in. So if you did the right leg, then we're going to do the left leg, and if you did both legs, we'll do it again. So starting from the beginning, hand onto your ribcage, inhale, and exhale, pelvic floor active, TA active. Inhale, and exhale, right leg into tabletop. Inhale, exhale, left leg tabletop. Inhale, Exhale, pelvic floor TA active. Inhale. Exhale, right leg raises. Inhale. Exhale, left leg raises. So if you have one leg up, just make sure you're doing the opposite leg that you did last time. Hands onto the thighs. Thighs pushing up into the hands and the hands pushing into the thighs. 30 seconds here. If it gets too difficult, you can drop the legs into a bent position or all the way down on the ground. Remember, this is core from the base, so you have to see which option is best for you, and no option is a bad option. The easiest option can still be difficult, and it can build your core stronger than trying to overcompensate with a harder posture or harder position. Keep going, push the hands into the thighs, keep the pelvic floor active, keep breathing. 5 seconds. And then hug the knees into your chest. And you'll start to feel that everything is nice and active now. So we're going to start by having our pillow quite close by the feet, and lying on your back. Take the right leg up into a straight position. If it's too difficult for you, if you don't have that hamstring length, you can keep your leg bent. But just try and open it up that little bit further than your normal dead bug position. And then activate through the lower core, belly button pulling down to the spine. And we're going to lower the leg all the way down to touch the pillow, if you can. If you want to double up the pillow, that's great. Touch the pillow, activate, tuck in the tailbone, pull belly button to spine, and then raise the leg all the way back up. Very slow and controlled movements here. 4 more, slowly down. Hands are on the pelvis to make sure that one side's not lifting up, and they're both even. Control it as it gets lower, because that's the point where everything gets a little bit harder. Touch the heel to the pillow, control the movement up, activating and tucking in the tailbone. Slowly down. 3 more. As soon as you get past your left knee going down, it gets a little bit harder, so just control it that extra more. 2 more. Slowly down. And lift up. Last one. Slowly down. Keep the core active. And lift up. Taking the foot down and taking the left leg up into the sky. Trying to straighten the leg. If it can't straighten, at least more straight than a bent leg. Lower back pushing down into the ground. I don't want you to hip hitch here, so make sure your hips are stable, and then control the movement. Remember, left side might be a little bit weaker if you are right dominant, so just take extra care for the left side, especially in the core. Slowly dropping the heel down. As you get lower, keep the concentration there even more. I know these movements may seem easy, but if you do them slowly and controlled and get that mind to muscle connection, you will feel a big difference. Slowly lower it all the way to touch the floor. Lift using your core. 2 more. Slowly lower. And lift. Last one. Lowering it down and lift it up. Place the foot down onto the ground, and now in this position, I want you to take the right leg up into tabletop, tuck in the tailbone, belly button to spine, pelvic floor active, and we're going to pull the knee all the way up and then drop the toes to the pillow. So we're going into a deeper part of our lower core. So you have to really hug that knee in without using your hands. You have to use your lower core to pull it in. And drop the toes to touch. 3 more. Pull it in. And drop down. No movement of the hips. Pull. And drop. 2 more. Pull. Knee in as close to the chest as possible. And drop. Last one. Pull in. And then slowly lower that leg back down into your crook lying. Now, take the left leg up, and we're going to do the same thing, pulling the knee all the way into the chest. Make sure there's very minimal space between the chest and the knee, and then control the movement all the way down and lift back up. Pull the knee in, slowly down, and lift back up. Pull, 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 pull. 2 more. Control the movement down and lift. Last one. Slowly down and then lift it back in, pulling the knee as close to the chest as possible. Slowly lower that leg, and now we're going to go into a harder option of those 2 exercises. So if it's difficult for you and you want to keep it to where we were, you can keep the foot on the ground. But if you want, we can move into a dead bug position, making sure your lower back is pushing down onto the ground. Then you can straighten the right leg, keep the left leg bent, and take it down. If you want to just take it to 45 and keep in this position, that's okay. So you can just do a very small movement here. You can even bring your chair just to get your foot to touch the chair and lift it back up. And if you want, you could keep it down, or you can just go all the way down to the pillow. So whatever option is best for you. And make sure that the option you choose is something that you can sustain. So slowly lower the leg down and lift. 3 more. Slowly lower, especially as we get to this point here. Lift. 2 more. Touch and lift, wherever you are touching, whether it be the chair or double pillow, or just having your opposite foot on the ground. Last one. Control the movement. Make sure the leg is straight, the feet are pointing up and not inwards. You're not rotating your leg. And then we're going to switch sides. So just come down for a bit, tuck in the tailbone, belly button to spine, right leg raises, left leg raises, and we're going to start by straightening through the left leg. Slowly and controlled, lowering it down to the level that you need today, and lifting back up. Try and keep the same level for both sides. So even if you feel stronger on the one side, just go to the other side's maximum and do that. Control it down. 3 more. Really slowly as we get to touch the pillow or the chair. 2 more. And last one. Raise the leg up, hug the knees into the chest, and we're going into our opposite variation. So now we're going to come back into our dead bug position. So activate into your lower core, pelvic floor active, ribs engaged, TA active. Push the thighs into the hands, and then keep that movement stable, and take the right leg up into a dead bug, left leg up into a dead bug, And you're going to keep this position or go back down to option 1 where one leg is on the ground. And we're pulling the knee all the way in now. Right knee comes in, keeping the left leg as still as possible. And then toes to touch the pillow. Right leg pulls in. And slowly touch the pillow. 3 more. Right leg pulls in. Slowly touch. Right leg pulls in. Slowly touch. Last one, pull the knee in and make sure it's not coming out to the side. It's really pulling in the same plane of motion. And then bring the foot down to touch. Come back into your dead bug and start with the left side. Take your time. If you feel like you need a break between the two, that's okay. Pull the knee all the way in. It's really difficult not having the other leg on the ground to help with that movement. Leg down to touch and pull in. 3 more. Down to touch and pull. 2 more. Touch. Pull in. Last one. Touch and pull in. Hug the knees into the chest. Just rock a little bit from side to side. And now we're going to come into double leg lowers. So we're going to turn around and have the chair with us, or if you have your chair where you are, that's okay, where you are. Bring the bum as close as you can. And we're going to start, first of all, with one leg on the ground and the opposite leg up above. And you're just going to go down to touch 10 times, pulsing it up, lifting up, using your core. So keep the core active and pull it in, compress it in as you lift the leg up. 4 more. 3, pull in, last one, other side, taking the leg down and lift, pull it in, 2, belly button to spine, pelvic floor engaged, 3, 4, lift it, 5, 6, do a ballistic movement, really pulse that leg as far as you can, 3 more, 2 and 1. Hug the knees in. And now let's come into our dead bug position. So start from the floor, activate lower back down into the ground, right leg comes into tabletop, left leg comes into tabletop. Keep active, keep your pelvic floor active, right leg raises, and then you can slowly lower it to the chair, lift. We're doing nice, big, and quick movements. 3, 4, 5, 6, 7, 8, 9, 10. Switch sides. Left leg straightens. Down and lift. Keep the core engaged. Not too much movement of the right leg. Control. Even with this fast-paced movement. 9 and 10. Hug the knees in. Now we're going from the different angle where we're going to have our leg on the ground and we're lifting it to the bottom of the chair. Okay. So, if you don't have the chair there, it's okay. You can move the chair to the side and you're just lifting up a tiny bit, about 6 inches off of the floor. And tuck in the tailbone. Make sure your lower back is on the ground and you're going to lift up and down 10 times. Very small movement, but keeping control of your pelvis. Make sure it's not moving. 3, 2, 1. Opposite side, take the leg out and down and up. Very small movement, about 12 inches or 6 inches off of the floor. It's a big difference. 3, 2, and 1. Now we come to the double leg. So, hug the knees into the chest. Come into your dead bug position. You can place your legs there. Take your hands down. You can take the hands just slightly underneath the bum if you need that. And then try and straighten both legs. If it's difficult to straighten, you can keep that slightly bent position at the beginning, and then you go down to touch the chair and lift it up. So just a small movement, taking it down to the chair and lifting back up. If you can, have straight legs, take them all the way up, down to touch, and lift. 7 more. Slowly down and lift. Control through the lower core. Try and feel your muscle fibers in your lower core. Keep them contracted as you get to the chair, but even contract them even more. Pull them in to lift the legs. 5 more. Pull in. 4 more. Feel the muscle contraction in your lower core. 3 more. 2. And 1. Hug the knees into your chest. Rock a little bit from side to side. And if you feel like you are getting better, then you can move back to try and make it a bit difficult or more difficult. Taking the hands underneath the bum just helps a little bit with the pressure. Tuck in the tailbone. It also knows where your hips are in space. Take the right leg up, left leg up into dead bug, both legs up. Control the movement all the way down. Remember, if this double leg movement is too difficult, you can stick with the single leg movement. Control the movement. 3, 4, lift from the lower core, don't get lazy. Heels to touch, activate through lower core, lift. Good, 3 more. Lift. If it gets difficult, take a break. 2 more, we want good contractions. Last one, lift. Hug the knees in. And we're going to turn around for the pillow. So let's see, this can be our post-assessment of our lower core. So, lying on your back, activate through the lower core, the deep inner core, and take right leg up into a dead bug position, left leg up. Straighten one leg, straighten the other leg, and you can have your hands underneath the bum if you need, just for that little bit of support. Taking the legs all the way down, and remember, it's also about quality of movement. So if you feel like you went the same way, now just see how you are activating. Do you feel it now more in your lower core? And lift. Do 3 more, slowly down, pelvic floor active, deep inner core active, keep breathing. 2 more, lift, last one, and lift. And if you want to try without the pillow, take the pillow away, legs up, slowly all the way down, and lift all the way back up. And then come into a seated position. Well done for finishing our lower core. Now we're going to go into our full body mobility. So, starting on the mat, we're going to go into a downward dog position. Pedaling out through the calves here and just activating through the pelvic floor, keeping the lower core active. And you'll feel a difference with that compression. Trying to get the chest to the thighs is a little bit easier when your lower core is active. And then slowly raise that left leg up into the sky. Bring the leg all the way through. Place it in between the hands. Drop the hips down nice and low. Walk the hands all the way around to the side or to the right knee. And keep dropping that left leg forward as you do this. The knee over the toes. Then bring your hands back again and take the left hand to the right foot if you can. If you need a band, use a band to try and grab the foot. Drop the hip down nice and low. Keep trying to get deeper into each movement here. And then move back again. And this time, trying to get your body forward so that you're stretching into a little bit of your adductor here, keeping your lower core active. So we're going to be activating through our hip flexors and lower core and our adductors or groin more in this class, just because our lower core is more active, so you can tell the difference now. And then take it all the way around again, taking the hand to the foot, dropping the hip down nice and low, keeping your lower core active and belly button to spine. Bring it around again, dropping that back foot behind the knee this time as you go into the adductor stretch here. Just getting further each time. Bring the hands back again, lift the foot up, take the left hand to touch the toes, try and drop that down. Slowly lower the leg and then take the hands onto either side, bring it back into downward dog, right leg raises, bring the knee into the chest, place the foot down, drop the knee to the floor, and you're walking your hands to your left knee, keeping the leg where it is, and keep dropping the right knee over the toes. Stretching here. And then move back again, taking your right hand to your left foot, dropping the hip down nice and low. Keep moving in and out of these positions, making sure you're getting a bit deeper each time. Using your breath and also activating your core to get into different muscle groups. Take the hands around and then just going a bit deeper this time, pushing the right knee over your toes and dropping the hips down towards the floor. 3, 2, 1. Bring the hands back, right hand to the left foot, drop the hip down towards the floor. Keep core active. Slowly lower that leg, bring the hands down. This time the foot comes all the way back behind your left knee, and then keep dropping forward into the right leg here. Getting nice, deep, and open into our adductors and groin. Come back to center last time, taking the hand to the foot, just trying to get a little bit deeper into this hip flexor stretch, and then placing that foot down onto the ground, hand onto the outside of the right foot, come back into a downward facing dog. activating into your lower core to get a little bit deeper here. And then come down onto your knees. You can place the pillow underneath your knee and take the left leg out to the side. And then moving, or keep your tailbone tilted as you take the bum back all the way to the floor or to your heel. Just going in and out, making sure your foot is facing forwards and the outer part of the foot is on the ground, creating an arch in your foot here, feeling that adductor stretch. You might feel it more in your knee if you're extra tight in these certain adductors. 2 more, just moving in and out of it. Last one. Now, take this leg and take it out to the side. Drop forward and back. Keep going. Make sure your foot is facing forwards. There's an arch created in your arch. And keep moving the bum back to touch the toes. But make sure you're tilting your tailbone so bum is out and up towards the sky. So even if the movement is not great, you're not getting a lot of movement, you're getting quality of movement. 2 more. Last one. Taking the pillow away, or if you have 2 pillows, place 2, one under one knee and one under the other. And we're coming into our frog. So having the feet directly, or your ankles directly behind your knees, your feet are turned out to the side, and then you come down onto your elbows and you just do little pulses forward and back, side to side, forward and back, side to side, and see which one is tighter for you. So if for me, going from side to side is a lot tighter than going forward and back. But doing all the motions to try and open up into the groin, tilt the tailbone to the sky, it's always going to help. Keep moving, side to side. And then slowly come up. And close the legs together. Come back into a downward facing dog. Just moving the hips from side to stretch up into the shoulders here, into the sides of the body. And then dropping your knee to the ground and then taking it to the side with a bent leg. And you're going to take the hip down to the ground and move your body to the side. So we're stretching into the lower back here, just opening up into the SI joint, a little bit into your glute minimus and medius. So you're not in a pigeon position, your leg is just bent out to the side. And then switch sides, so you're going to take your left knee to the ground, slide it to the side, drop the hip down to the floor, and just try and get your right hand through, twisting here to try and get through the back of the hips and the lower back here. Slowly come out of it and come into a cross-legged position, taking the right arm overhead, left hand behind the back, and try and join the hands together. If not, hold your shirt and then just push your chest forward. Drop it down, push forward. 2 more. Push. Last one. Push. And change sides. Taking the right hand behind the back, left hand. And just drop the chest and lift. Pushing the head back into the hand, just to open up the tricep a little bit more. 2 more. Last one. And shake the arms out. Do a little bit of shoulder circles. Well done for doing our whole lower core and full body mobility. I'll see you at the next class.